ladies and gentlemen. You're welcome to Spotlight on NAJA TV, a co-production of NAJA TV and Sisterspeak237. I am Comfort Musa, your host on the show. Today on Spotlight, we talk about backstreet abortions. Yes, I know. People get very uncomfortable around such a topic. More reason why we need to talk about it today. On the program today, we have with us Dr. Eko Philbert, obstetrician and gynecologist, member of the Cameroon Society of Gynecologists. Doc, you're welcome on the program.
Thank you very much for welcoming me on the program.
Great, and we have a young lady. She's a teacher, and on the platform today, she represents the voices of young Cameroonian women, Laura Fude.
Thank you very much, Kami.
Good to have you on Spotlight today. And the topic for the day, backstreet abortions, is a topic that many people are not comfortable with. You know, when you say backstreet abortions, people twist their faces. That discomfort is evident. Are both of you comfortable talking about this? Doctor, are you comfortable talking about backstreet abortions?
Comfortability per se, of course, yes. But now with the audience, you need to know how to articulate in such a way that the sociality of it can be perceived and not the negative part of it.
Perfect. And for you, Laura, young girl, you are 25? 25. Is this a topic that comes up often amongst young girls, the topic of abortions and pregnancies and all of that?
Amongst young girls, it's a very common topic. We get to talk about it a lot, but not in the public.
Okay, so with your friends, you discuss this. Where, how do you talk about this?
Most times you can do it online, in groups where we meet.
Like WhatsApp groups?
WhatsApp groups especially, yes. Or maybe we meet by a phone call. We just sit in a little gathering, then we get to talk about it.
As long as it's not public?
As long as it's not public. And no other person gets to hear about it.
So it's deep secret?
Yeah.
Well, as hushed as some of these conversations may be, the Society of Gynecologists in Cameroon have a project that addresses unsafe abortions because they think that the prevalence is very high. And I'm coming back to you, Dr. Eko. Why is the topic of backstreet abortions and unsafe abortions such an important thematic area for the Society of Gynecologists in Cameroon?
Yeah, Komi, thank you very much for that question, which is very pertinent. On the scope of maternal mortality, there's maternal deaths. It has been proven that abortion or unsafe abortion is one of the major causes of not only deaths, because at times we see just deaths, but severe complications also attributed to unsafe abortions. So that is why, because the country as a whole and the world as a whole has the general impression to fight against deaths linked to pregnancy, because pregnancy in principle should be something that should be a positive experience.
Right.
It shouldn't be something of a negative experience. There is nobody in principle who will be pregnant and think of going to death or developing a severe complication. So that is why this specificity of abortion, which is one of the major causes of deaths linked to pregnancy, is something that we are looking close to because it's also preventable.
Right. And as a gynecologist, in your hospital, how often do you see women coming to consult, with complications arising from unsafe abortions, say in a week?
Yes, in a week, if we say it's a serious problem, it is becoming a public health problem. It is not just, say, hospital-based issue.
Right.
In principle, with respect to science, any problem that surpasses 10% is more a public health problem. It's not just hospital-based. maternal deaths linked to unsafe abortion. I'm just talking about deaths, not even severe complications.
Yeah.
And again, if I'm talking about deaths, if we do the ratio between death and complication, it has been proven that to one death gives rise to 30 complications.
This is within Cameroonian context.
Cameroonian context.
So
it means the
death,
ratio of deaths per severe complication is 1:30. Don't just imagine that if we have, say, in my hospital, I have 13% of deaths linked to unsafe abortion. Then imagine the number of complications with respect to that same number. It means 100 abortions. How many complications arise from that? So you see that is a serious problem.
Right.
Very serious, and because it is preventable. Everything that is preventable, we need to work on prevention. The Englishman says prevention is better than cure. So why not us work mainly to prevent this?
The deaths and the
complications.
Right.
Instead of trying to catch up with death or complication.
Laura, I see you, looking intently, and when he talks about the complications and the deaths, you are worried, as anyone who is listening should be. And amongst young girls, these issues of unsafe abortions, before the program we're talking about the prevalence. You hear cases every day amongst your friends who want to terminate. They get pregnant, they don't want it, they go to the quarters, some are raped, and they want to abort, but they go to the quarters and get it done. What is it about pregnancies that young girls are so eager to terminate that they go and do it in the quarters? Why? Why do they do that?
Thank you so much, Komi, for that question. That's a very pertinent question, but it has a lot of reasons. I'm just going to start with the first. Most times rejection pushes young girls, a lot of young girls, to go for abortions. And now the fact that you are rejected, you don't even have that opportunity to get to someone who can lead you maybe to a good hospital where it can be done. You find yourself at the end of the day going to friends, doctors in the quarters, these street peddlers that sell drugs. You go to them, and at the end of the day, they end up doing it for you. The backstreet abortion.
And many girls are doing this.
Many girls are doing it. I can say maybe if we have 100 cases of abortions, believe me, 95% of them
are
done in the quarters.
So it's the rejection from society.
The rejection from the society, the family, friends, because there's peer pressure too. You have your friends, they're like, oh, elle est enceinte, generally as it is said, oh, elle est enceinte, un peu plus marche avec nous, on est encore chaud, elle est là, le gros ventre. You eat some little words that they throw at you, so you're like, you're no longer comfortable being around your friends, you're no longer comfortable even with your own self. You look at yourself like, you're like, what's happening? What is this? You're no longer free to go out, hang out, maybe you're clubbing, you're outing with friends, and they just prefer to terminate it to avoid having any headache, any stress, and to live a free life.
And so typically, I know every case is different, but typically a girl gets pregnant, she's uncomfortable with the pregnancy, maybe it's from rape or whatever the cause of the pregnancy is, and she doesn't want to keep it. Where do they go to? Who tells them where to go to? Who directs them to the street corners where they get
most often you have
the drugs to terminate?
Most often you have friends who have experienced that before. So at times they come, and most times they don't even go directly to tell you. Like for a case I saw recently, she came to the group and she was like, oh,
WhatsApp group?
Yes, the WhatsApp group, and she was like, oh, my neighbor talks, he may do how. That kind of a long story. I mean, she was the one involved, but she didn't want to come out.
She was asking for a friend.
Yeah, she was asking for a friend. And she was the friend in question, but she didn't want to let us know that that was the key. So she was like, so a girl just pivoted her and said, meet up me, we will talk. You tell their friend, you can see me. So it was like, okay. He just had the notion that this other girl has an experience about it. So when we tried to find out from her, later we got to discover she was the one involved when it got complicated.
So she actually got recommendations from a friend in your group,
in the group, and
had an unsafe abortion and had complications.
Yes.
So usually it's referrals from other young girls.
Apart from that, so you have referrals from the drug peddlers on the road. Because most times young girls go to them and they're like, oh, le père, voilà la situation, on fait comment? And the next thing he's like, okay, for example, you just say, donne-moi 7,000 là.
That's 7,000 francs, yes?
7,000 francs, and he's done. After he's like, c'est combien de mois? Tu as combien de semaines? And you're like, oh, okay, he can do this, he can have this thing done for me. You're like, you're excited, you just want to, he should get rid of it, and he gives you drugs, going by the number of weeks or the number of months that you tell him. Then when it gets complicated, maybe bleeding is severe, or maybe you took the drug and he had no reaction, because some people really have a difficult system. You might take the drugs, he has no reaction. They come back to them to tell them like, oh, j'ai pris le remède, I've had the drugs, I've taken, I've done all what you said I should do, but nothing happened. Or I've been bleeding severely for the past 3 days, it's not stopped. The man now takes the person to the quarter doctors in the clinics. And when you get there, they are not interested in finding out the boy, who your mother is. In fact, they don't even want to know your name.
Okay.
They just want the money. If he says it's 30,000 francs, he just wants his 30,000 francs and he gets done with it. Most times you see some girls even, they don't want to take drugs. Because when they go to those drug peddlers, they say, okay, tu vas signer, ça va te faire mal pendant tes 4 jours, few pains and all that. And she's like, no. Or maybe she was like, no, I have a program, I have something. Or I don't want anyone to notice I'm bleeding.
Okay.
Because maybe in the house they'll notice you bleeding, it might be suspicious. Maybe the pain, you never had menstrual cramps, then now all of a sudden they see you bleeding and you're feeling pains. So she doesn't want that, and the next thing, she says, okay, non, je vais pas, on peut faire comment? He says, okay, if you don't want this, then I'm going to take you to where they can evacuate it at once.
And this is still in the quarters?
Just in the quarters. They go to the back street, doctors behind the doctors in the quarters, and they get it
usually
done.
at these clinics, hospitals with nurses, or what kind of hospitals are these in the quarters where some of these peddlers will take the girls to?
There are hospitals with nurses.
Okay.
They have nurses. But
they
now,
don't,
the funny fact is, at times, there are some nurses that don't know that this is what the doctor is doing.
Okay.
You understand?
Okay.
Most times, you will just come with him. The doctor already knows. He might have one nurse there that knows about it. When the nurse says, doc, c'est pour. The doc already knows what it is. He can take you maybe into his room, or he says take her into a private room where it's just nothing. And the others know that maybe it's a normal patient that is sick, wants to do a private consultation, or maybe they are giving you a drip or an injection they don't want others to see, then they get it done. Okay. Some nurses don't know, and when you come out, you're like, and they're like, hey, my dear, you feeling, no, your fever, this and that.
And the young girls know these networks and they exploit it because you're saying it's safer. They go there, they don't ask your name, there's no record of what you have done. Record. You just do it.
In fact, the very next day, ni vu, as the Frenchman says, ni vu, ni connu.
Okay.
Until maybe when next she has a customer to bring and say, okay, I have a friend to take her there, or maybe she is in the same situation again and wants to go and get rid of it. That's when she goes back.
That's what happens. And this is common amongst young girls, especially in the urban centers. Doctor, what she describes is typical of a town setting. What does backstreet abortion look like in rural areas, where you don't have big hospitals?
I listened to her very keenly. It's interesting, very interesting. Interesting in many aspects to understand what they think, what really happens, and secondly, to bring some clarifications with respect to the perception of the outside and the inside. First of all, I just want to make simple clarifications that backstreet abortion or unsafe abortion is not because it is done by a doctor or because it is done in a hospital. We need to measure things to say an abortion is safe.
Okay.
The safety of an abortion has nothing to do with its legality or illegality. Okay?
Medically.
We just need to, whether it's safe or unsafe, it can be legal or illegal.
Yeah.
Okay? Now, for it to be safe, it means it has to be done by a qualified personnel in an appropriate environment. Qualified personnel is not just the training that you've done, but the environment. It means infection prevention methods, the equipment that you use, and so on and so forth has to be adequate. And then the environment that is done also has to be an appropriate environment.
Yeah.
So it's not because it is taken to a doctor somewhere, and especially that most of the times any person that puts on a lab coat is called a doctor.
Right.
Okay, so that is one issue that we should understand. And secondly, the legality and illegality depends on what the law says with respect to abortion.
We'll talk about
that some other time. But again, you should know that we are trying even to go out of that, whether it's legal or illegal. What is important to us as physicians, as gynecologists, and in the Society of Obstetricians and Gynecologists is to prevent unsafe abortions. No matter what, prevent unsafe abortions. In the villages, in the rural areas, as you just said, you don't have many health institutions. So most at times, young girls, and again, it's not only young girls, the recent statistics have even shown that more of those who seek these abortions are even in a couple.
Okay, so married women.
Married women.
Older women.
All are also in the same situation. So it's not stigmatizing the young persons.
It's not just young women. Yes.
It's the whole cross of women. As I said, in the rural areas, the first thing is they don't have a lot of health institutions. So what most of them do with respect to what she is saying, if you Nikonu, is maybe certain herbs that they take which might be more detrimental to their system.
Right.
Apart from the herbs that they take, some use spokes, bicycle spokes, and use it and insert in their private parts and thinking that it will help in one way or another. Yes. Some use cassava sticks and believe that with that it can help to carry out the procedure. Some go on and take certain medications.
Unprescribed by doctor.
Unprescribed, of course. Number of tablets of I don't know what, this medication. They'll just tell you that I took 20 tablets of this, because you don't know that when you take an overdose of a medication, even if the side effect in quotes of that medication is inducing an abortion, the effect of that medication on your own system is also detrimental. So you're trying to solve a problem, I put in quotes, solve a problem by creating double problem.
Right.
Some would decide and say they will take, I don't know, a bottle of whiskey, as what we hear every day. What is the cost of a bottle of whiskey on your system or in your system? Those are the things that they don't appreciate. They don't weigh. We, in the area of medicine, that's when we understand what these different aspects, different things that they do affect their general system. So that is it. You see yourself, you have bled, and you believe you have expelled. Yes, let us consider that it came out. What consequence has what you have taken caused on your system, your liver, your kidneys very soon. We are having a lot of renal failures now in Cameroon. You start asking yourself, where are they coming from? It's most of the things we do. Medications that we take, things that we drink without getting the consequences of on our vital organs, your kidney, your liver, your heart especially.
And these consequences, you have described them as severe complications, just so that our viewers understand what you're saying clearly. What are some of the severe complications that women come to the hospital with after unsuccessful backstreet abortions?
I want to say I really appreciate that question. And responding to your question, I'll just respond to one of the comments that the co-panelist gave, in the sense that it's a friend who will advise another friend because maybe she's been a clear victim and she's done it and she's succeeded in it. I just want to make something very clear. One person's name is Susan, another is Mary. It's not because Susan took something and it happened to work. It means that if Mary takes that same thing, it will work.
Right.
It might work but causes another effect on Mary that did not happen to Susan.
That's true.
And that is why even in other pathologies, we always say, don't imitate the prescription of another person, even if you're having the same symptom that that other person is having. Consult and they diagnose your own problem and give a drug that is adapted to you and to you alone. So that is what happens. Before even coming to your studio, I received one lady today who came for consultation, and her consultation is simple. She's not seen her period for more than 6 months now. And on investigation, I realized that some months, more than 6 months ago, she engaged in a practice like that. And on my investigations, I found out that she's developed one of the severe complications of the act that she carried. That severe complication is what? Simply that the inner cavity of the uterus has become completely closed. So she does not have a cavity again of the uterus that can cause her to see her period. It's completely closed. And with modern medicine, or with the medicine of today, if your cavity is completely closed, we have practically nothing to do.
And this is a consequence of an unsafe abortion.
Of course, it's a consequence of an unsafe abortion. It's a consequence of something that was done by somebody who was not experienced.
Not qualified,
not qualified. And this lady, this young lady, has developed this complication. And what made her to come? She's just gotten into a home with a man who is postulating to get married to her. They are looking for children. And now she's in a state of a big dilemma, just because of something that she would have prevented long, long ago. Practically, it's a difficult situation, but I just had to tell her exactly what she has and the prognosis of what she's having. That is not only one. You have some that we have practically every day with severe infection, that they will come, and some come in a semi-comatose state that you need to do all your best. But again, I will say we try our best, but we cannot do some certain things. And when we do that, because our role is to save lives, no matter what, whether it was illegal, whether it was legal, when somebody comes to you in the state of death, you must do your best to save her life before looking on how to prevent the same thing from happening. So we don't. And again, that's why I respond to Madam to tell her that we're trying to do more of sensitization to avoid this stigmatization and accusing or stigmatizing women. When you come, we don't accuse you for an act that you have committed. We try to solve your problem and then try now to counsel you on the consequences of that act so that you don't repeat the same act.
All right. We will take a break. Please hold that thought, and when we come back, we'll continue the conversations from where we're leaving off now.
Nous avons pensé. Pour mieux répondre à vos attentes, nous avons rehaussé le standing.
Hotel Loquet d'Orsay, better than what you imagine.
Welcome back on Spotlight. Today we've been talking about the factors that push women to backstreet and unsafe abortions. We've had Dr. Philbert Eko and Laura Fude telling us some of the factors that push women, and we're looking at solutions at this point in time, because Dr. Eko, you've given us some really disturbing statistics on how many women die from abortion-related complications, and how many women are living with very severe complications from unsafe abortions. And so, Laura, I'm coming to you as a young girl who is exposed to the realities in society. What do you think we should be doing at this point to make sure that more young girls do not end up in graves or with severe complications like the ones Dr. Eko has been describing here?
I think the first thing, we are going to sensitize the young girls on avoiding getting pregnant. And how are they going to do that? If you cannot abstain, maybe you can use condoms and or other preventive methods that are best known by the doctors in the hospital. And again, I think if you find yourself in such a situation, maybe the mistake happens, or it might be due to rape. First, I would advise the family to stand by the young girl, because most times they turn to abort because the family rejects. They are like, you're just like an outcast in the family. So because you don't want that to happen, or maybe you've had your mom say, oh, you carry belly for years, don't die. You carry belly, you go pack your thing. So I'm certain, so she's like, I will not even voice it out to my mom. But when it gets complicated, now the family gets involved, and it's a whole shame. So I would prefer the mothers talk to their girls, talk to your girls, sex education, educate them on sex. And when it happens, you should be friendly with your daughter in such a way that she should be capable of coming to cry to you that, Mom, you taught me this, but I made a mistake, and this is what has happened. From there now, you can look for a solution with her. And if the idea of aborting ever comes in place, the mother or the parent should be in place to take that young girl to the right place, to good hospitals, and find out from there how it can be done, rather than letting the young girl on her own for her to go to the backdoor clinics.
Yeah.
Then, again, another thing I'm going to advise is that young girls, please, I'm pleading, this is a plea of a young girl, try as much as possible to avoid listening to friends, to their advices. If you see you cannot take it to your parents, or maybe you're scared, go to someone, an auntie, someone, your mother's friend even, that you know maybe the person can come and plead on your behalf. Or even better still, go to the hospital and let the doctor call your mom and say, okay, your daughter has come, this is the case. Maybe he'll be in a better place to calm her down. Than you listening to the advice of friends, you get into taking pills.
You mean medical advice?
Yes, the medical advice, of the untrained doctors that
That's
became
the
doctors
friends.
by themselves, your friends, because they will give you wrong advices. And at the end of the day, when it gets complicated, they are like, no, me, now me, I tell you, me, so. And you find yourself in the shock alone. She's there, it worked for her, it didn't work for you. And tomorrow you're crying, she's the first person to mock at you. And again, I will take my own example. When you have been a victim once, maybe of a teenage pregnancy, I would advise the young girl to avoid repeating that same mistake. You can control yourself. Let your experience be your teacher.
What's your example? You got pregnant as a teen?
Yes.
How old were you?
I had a daughter at the age of 17.
Okay.
And I was blessed because I had a family who supported me.
Okay.
My mom especially was a big support to me. And up to today, I say to her, thank you for that. Because I would have found myself maybe today in severe complications like doctor said. But she was there all the way to say, if you even think of aborting, please, if I just give birth to the child, abandon the child with me and go you. Yes, than for you to think of aborting
So your
the
mother
child.
gave you the support necessary
necessary
to have your baby?
She was there each day. She would call, she would talk to you. She would even go to the extent when the stomach was bulging out. She would come, she would play with your stomach, She would just make you feel like, no, I love you. When you show the child, despite the mistake you made, I'm hurt, but I love you and I still accept you. You see, the young girl, she feels fine and she learns from her lesson. And when she gives birth, I encourage every parent to sit the child down, talk about family planning.
Did your mother discuss family planning with you?
Yes.
At 17?
She did that.
Okay.
She did that. She said,
Good.
you never know. Life is just the way it is. You can never say it will never happen again. So the best is to prevent. Prevention is always better than the cure.
Okay.
So she prevented by talking to me about family planning. She made me see the negative and the good of the blessing of having a child, but the negativity of it at a young age. And I had to learn from that experience.
Okay.
Maybe the time you no longer go to a day school, now you have to go to an evening school, but you have to take care of the baby in the day and go to school in the evening. Then one thing I so loved about her, she gave me the opportunity to go back to school.
Okay.
Yes. Most girls find themselves back in the same mistakes because when they have that first baby, they are like abandoned. Yes, the family accepted her, you don't born, no. You're now abandoned, you're on your own, no advice. So she's like, okay, I have to struggle now to take care of this baby and all that. Then she finds herself in the second mistake.
Repeating it, okay. And we hope that women, young girls, older women get the support they need, to lead healthy lives, especially as far as maternal health is concerned. Dr. Eko, you see these cases, you work in the communities. What can we do to roll back, these high numbers we're having, deaths from abortions, related complications, and all these severe complications like the case you saw today?
Thank you again for your questions. I think that's our objective, to try to put a stop or reduce the prevalence of complications and deaths, but mainly complications first, because most people don't see complications. They see but deaths.
People don't talk about
They don't
it.
talk
It's
about
taboo.
it. It's really taboo.
Yeah, it's a taboo subject, so
Really
people
taboo
hide it.
subject. Really taboo subject. That is why we need to talk about it.
Right.
We should remove the notion of taboo concerning pregnancies, concerning abortions, in such a way that persons will not be stigmatized and it will be easier for them to approach the competent service for
counseling.
And again for a proper service. There are many targets to try to reduce the prevalence of complications and deaths. The first target, as she just said, is the family. It has to be the general population. We say everybody can help in saving a life linked to unsafe abortion.
Right.
Everybody should try not to be a barrier to the service of eligible abortion cases. Nobody should be a barrier.
What do you mean by eligible abortion cases?
With respect to our legislation.
Okay.
Our legislation is clear. We have time to talk about that.
Right.
Our legislation is clear with respect to those who are eligible
to get the service.
The service. So nobody should be a barrier to those cases. Whether it's the victim, whether it's the family, whether it's the community, whether it's the legislationist, or whether it's the health providers, nobody should be a barrier to this service. Secondly, if everybody puts him or herself in the position of not being a barrier, what do you need to be capacitated on? What do you need to have as weapon not to be a barrier? First is we need to go on sex education. There need to be sex education.
At what level?
At the level of the young girls and at the level of the family, the mother and the father. What I mean, those who are responsible for these young girls. If they don't have the knowledge, they cannot give sex education to the young girls. So they should have the knowledge, they should be educated upon, and they can transmit the education to the young girls. Or the young girls directly
and young boys.
And young boys certainly. When we talk of young girls mainly because they are the ones carrying the pregnancy.
Right.
And again, of course, young boys and young girls, but I will continue to insist. All the complications and the deaths are on the girl and not on the boy.
Right.
So the girls, and I will continue to say this every day, that's what I say in my service, and that's what I continue to say, girls should take their responsibilities, even though we counsel the boys also not to engage in practices like this. But the girl should know that all the acts that she carries on is on her body. She is the one to develop the complication. And if she develops a complication today, she cannot give birth, she cannot carry out another pregnancy. That young boy will not stay with her. That young boy will turn and look for another girl. If she dies tomorrow, she is the one who is dead. It's not that young boy. That young boy will go for another girl and continue his life as if nothing has happened. So the girl should take her responsibility. The boy should not just say, you must remove that pregnancy. And she goes and starts committing the act of removing the pregnancy. If she develops a complication or she dies, it's she herself who has developed that complication and who has died, and it's not that young boy. If the young boy cannot take care of the pregnancy, the young boy cannot take care of you, don't bother about him. Know that it's your body that is engaged in this pregnancy, and all the consequences are on you and not on him. So those are the things that we need to know.
Sex education, girls taking responsibility for their lives.
Taking responsibilities of
at
their
the
lives.
level of the hospitals and medical personnel.
At the level of the medical personnel, again, we still say they shouldn't be a barrier. They shouldn't stigmatize. If they cannot, we are counseling them also to provide these comprehensive abortion care services. If they cannot provide, they should do what we call harm reduction. Harm reduction is not just shunning the young girl away from your service, but is orientating the young girl to another service, to another personnel who can do what you cannot do. Instead of shunning the young girl to go back to the streets and start listening to those who are not qualified. So we advise that they should apply the comprehensive abortion care services if they have the competence of doing that. If they don't have the competence, they should refer to persons or in other institutions where they have the competence to carry out the services of comprehensive abortion care.
For, again, eligible cases
of course, within the Cameroon
within
context,
the Cameroonian
law,
context. And just for clarity, who are those, according to the law, that are eligible to have an abortion in a hospital in Cameroon?
Thank you very much. For me to come directly to your question, I just want to say we have another target which is on the legislationist. The legislationist, we are also advocating with them to try to I will not say change our legislation, but adopt or adapt the legislation that Cameroon had already ratified with respect to international law. That is a particular article and a particular section with respect to the Maputo Protocol. So we are trying to work with our legislationists to see that this particular article of the international legislation is being applied with respect to Cameroon
but
context.
in
But
Cameroon,
now with our penal code,
right,
with respect to our penal code, we have two circumstances. Two circumstances where a woman or a girl is eligible for an abortion. Eligible for an abortion in any circumstance or in a hospital institution. According to legislationists, the first circumstance is a state where the pregnancy endangers the woman's health.
Right.
Where the pregnancy endangers the woman's health. In that circumstance, is the physician who can determine that the pregnancy endangers the woman's health. So this young girl, no matter your situation, you need to go and consult. The physician, the person who is competent enough, can see that this pregnancy endangers your health. Because if we take the
this
international
is something that
definition,
street peddlers cannot determine.
of course, those persons who are not qualified, who are not trained, who are not competent, cannot determine. And they might be doing it in back streets, and they might go to illegality and to unsafe nature of the abortion. Meanwhile, if you had gone to the hospital, it is very easy for this competent expert to say, okay, this pregnancy has an impact on your health. Because in general, I would just say, if the legislation is maybe define health in a very microscopic level, if the expert uses what we call the World Health Organization definition of health, they say health is a complete well-being, not only the presence of a pathology.
Just so that we don't stray from your thought, you were saying the legislation says if a pregnancy endangers the health of a woman, and if a physician can prove that, then she's eligible.
Then she's eligible.
Which other condition? You said there were two instances.
Yes, the second instance is a pregnancy resulting from rape. A pregnancy resulting from rape. Don't go to the back streets. So first of all, we are advising that all rape cases should be denounced. It should be denounced. And if you have a pregnancy resulting from rape, please come to the hospital. And in that case, you are an eligible case. Okay.
Within the Society of Gynecologists in Cameroon, I know you have a specific project called the ACAC project that looks into the issues of unsafe abortions for eligible cases in Cameroon and how to resolve this problem. Laura said young girls prefer to go to channels that may be unsafe because the bureaucracy is less, they judge them less, and these spaces seem more friendly. As a physician, as a gynecologist, do you think that Cameroonian hospitals are friendly enough for women who come in maybe with rape cases and all of that? Are these spaces friendly enough? Or why are the women running to go to backstreet spaces?
In all circumstances, people want to do things the fastest way possible. But they want to do it the fastest way possible without evaluating the consequences of doing things very fast. You see, it is very easy to take a shortcut. It is very easy to take a shortcut. But what is the consequence of that shortcut? Somebody who is an expert needs to tell you what is the danger, what are the dangers taking a shortcut. You would think that you've solved a problem by doing it very fast. But what are the consequences on you? With respect to the friendly nature of our institutions, it might be difficult, especially that it's not everybody who is trained in carrying out comprehensive abortion care. It's not everybody who is trained. So now the project that you've just cited, the Advocacy for Comprehensive Abortion Care project, that the Society of Gynecologists and Obstetricians of Cameroon is piloting. We're trying to not only sensitizing the general population, not only sensitizing the victims, but we're trying to make them understand. I'm talking about the users. We're trying to make them understand the complications of unsafe abortion, infertility, and deaths. We're trying to for them to understand these complications, one, and to see that they can prevent. Just preventing a pregnancy shouldn't be an accident. A pregnancy should not be an accident. She was just saying something very clear. And women should try to plan their pregnancies. Plan your pregnancies. There are a million ways of planning your pregnancies. Seek a competent expert. He will explain to you. You can just use your cycle and plan your pregnancies. If you don't want to use your cycle because maybe you cannot control yourself, there are many methods that you can use to plan your pregnancies. We advise girls to avoid, and we still say to avoid taking these, I don't know what they call them, but these pills that they usually take after an exposure, thinking that that is what will help them.
I think
that
it's called pilule du lendemain.
Something like that. I don't know what you call it. But it is not the best situation.
The morning after pill.
Yes, the morning after pills. We use morning, it is called emergency contraception. An emergency situation is not a planned situation. Anything that is emergency is a circumstance that takes you unaware. And unaware circumstances are not repeated because that particular substance is not very good for a woman for repeated consumption. It's not very good. So the second thing, as I would say, is with respect now to the provider, the physicians. We are capacitating them. We are training them to know how to receive these women. And the women should not be stigmatized for what they have caused to themselves. You are there to provide care. And you need to provide care in the context that this woman should feel comfortable. And then after that, you can do her now counseling to prevent the same circumstance from reoccurring. Those are the type of things that we're doing with respect to the users and with respect to the provider. And as I said, with respect to the legislationists, we are trying to meet with them to see how they can shorten the process with respect to these eligible cases. How they can shorten the cases, and how they can incorporate the general Maputo protocol that we have ratified into our penal code so that things can be easier for those who are seeking.
Thank you, Dr. Eko Philbert. We will now listen to some of our viewers as they have their say on this very critical topic.
Good morning. This is Professor Robert Leke, Emeritus Professor of Gynecology and Obstetrics and the President of the Cameroon Society of Gynecologists and Obstetricians. Your question to me is the relationship between unsafe abortions and maternal mortality. Yes, we have already shown in the central maternity in our earlier studies that unsafe abortion, complications of unsafe abortions are responsible for 30% of all women who are dying or all maternal deaths in the maternity. And this has also been proved in other countries. The next question was to find out what are the complications of these unsafe abortions. The unsafe abortions are extremely dangerous for the woman because they have earlier complications and late complications. The earlier complications will include hemorrhage, will include infections, will include perforations, both the bladder, both the intestines, and so forth. And these are very, very dangerous for the woman. Then the later complications will include infertility, extrauterine pregnancies, and chronic pelvic inflammation, inflammatory disease, and so forth. So those are the major causes of complications of abortions. Now, the next question you want to ask is, what do we do? Well, if we want to reduce maternal mortality through strategies that reduce the rate of and the complications of unsafe abortion, it will all start with education. This education will comprise of family education, sex education. Then we should be able to be sure that a woman who doesn't want to have a child can avoid having that child at that time by family planning. In Cameroon, the prevalence rate of family planning is very low. It's around 20%, and this is not enough. And there are very many couples that would want to have contraception and cannot have it. So we need to emphasize on education, we need to emphasize on sensitizing the population, and we need to be able to ameliorate our legal dispositions concerning abortions and unsafe abortions. But training of personnel, environment in which the type of abortions can be done, as well as the equipment that we will need for these abortions are very important for us to be able to solve this problem, which is a major cause of maternal death and for which we have to continue to fight.
As a journalist working on reproductive health issues, I have often heard of cases of death related to abortion. And I would like to say that abortion is a very serious issue in Cameroon. However, it remains taboo. We don't talk about it. Now is the time for us journalists to take up the issue and talk about it more openly to prevent these preventable deaths.
Welcome back. We are rounding off our discussions on this subject of unsafe abortions and the complications that arise from it and the deaths, and we're looking at a way forward how to prevent unsafe abortions in our society. Laura Fude, it's been great having you on the platform, and as you leave again, I would like you to share your last words with the young women that are watching us today.
It's a pleasure being here. And I'm very grateful for you inviting me, Komi. Doc, I just learned so much. I have a pile of questions to ask you, but I think we're going to do that later. There are many, many, many. Okay, Doc. And to the young girls, especially those that have listened to us, I hope your ears were wide open, because I've learned a lot, especially when he spoke about the contraceptive pills, the morning after pills. I've learned a lot because it's something the young girls use often. And I've seen people with problems, like my neighbor, she had a problem because she used it twice in a month. Okay. You understand? So I've learned a lot about it. So to the young girls, I would really advise, if you can abstain, please do. But if you cannot abstain, I would advise you go to the right channels, to the doctors, to those specialized in that field, to ask them how you can prevent unwanted pregnancies. As he said, maybe with your cycle, they'll teach you how to count it, or they'll tell you how to avoid it, because indeed a pregnancy should not be a mistake.
Should not be an accident. All right. Yes. Thank you very much, Laura. Thanks for coming and for sharing your story with us. Dr. Eko, as you leave the platform, what do you leave us with? Which message do you leave us with?
My message that I want to pass on before leaving this platform is, first, that we should save lives. We, everybody listening to me, and us, the practitioners, same like the family, we shouldn't be a barrier or being a block to provision of comprehensive abortion care services to eligible cases. Again, I want to say that we should know that many women, about 2, die practically every day linked to unsafe abortion. And as I'm talking about deaths, about 2 daily. And I just said that the ratio of death to complication is 1:30. So if 2 die every day, it means about 60 develop complications every day. It is unfortunate that I, as a gynecologist, had to receive women, young girls, practically every day with problems of infertility. And then when you go into their history, you realize that this is a consequence of an unsafe abortion that was carried out some weeks or some years back. Those are the key messages, those are the messages that I will pass on. And those who are, all of us, saving lives, we should know that health education is very important with respect to the users and with respect to the providers. All of us have to be engaged to save lives that are linked to unsafe abortions.
Thank you, Dr. Eko Filbert. Thank you, Laura Fude. Thanks, ladies and gentlemen, for joining us. We hope that the conversation doesn't end here and that we will continue to break the silence on this topic. You have heard for yourself the consequences of unsafe abortions, more reasons why we should talk about it, but more importantly, why you who has a question should go to the competent persons to get the right answers. Thanks again, and it's goodbye from us.